Thank you for joining Washington University Orthopedics to learn more about shoulder replacement surgery, also known as shoulder arthroplasty. This video series is intended to help you prepare for surgery and plan for your successful recovery. This is the second video of a 4-part series. The goal of this video is to discuss the medical workup and necessary steps to complete before you have surgery. Other videos in this series cover what shoulder replacement surgery is and how it works, the events that occur on the day of surgery and during your hospital stay, restrictions after surgery, important procedures and events to consider after surgery, and optimizing your recovery. When you meet with your surgeon and surgical care team, they will ask for a detailed health history, physical examination, and x-rays of the shoulder. Although your surgeon can often make a diagnosis with x-rays, other examination tests may be needed to assess the severity of the condition, disease, and associated problems. The two most common tests are a CAT scan and MRI. Your surgeon may use a CAT scan to further evaluate bone shape or deformity in shoulders affected by arthritis. An MRI or ultrasound may be used to assess your rotator cuff muscles and tendons. Your surgeon's office will likely reach out to your primary care doctor to obtain clearance for surgery. This is done to optimize your health before surgery so you may have the best outcome possible. Your primary care or specialty doctors may need to evaluate you before surgery. This is especially true if you have heart or lung disease. There are several contraindications or reasons not to have surgery that must be addressed before surgery. These include active infections such as bladder or urinary tract infections, pneumonia, or sinus infections. And surgery should not be performed when there are open skin sores. All of these factors need to be in control to protect you from complications around the time of surgery. Hospital policies around COVID-19 are often changing in regards to elective surgery. You cannot have the surgery during an active COVID infection. If you are on blood thinners, there are special considerations. All blood thinner medications must be stopped prior to surgery. These medicines are resumed after surgery. Patients take blood thinners for a variety of reasons, and each medicine has a different action in the body. Your surgeon's office will work with your prescribing doctor or specialist to develop a blood thinner plan that is appropriate for you. These instructions will be clearly explained to you by your nurse from the surgeon's office. For patients who resume blood thinners, there will be more bruising than typical, and there is a slightly higher risk of a hematoma formation under your incision. Some rheumatoid medications decrease your immunity and can increase the risk of infection. Please discuss these medications with your surgeon team prior to surgery. We will work with your prescribing doctor to develop a treatment plan. You will be asked to stop the following medications 7 days before surgery. A joint coach is needed to assist you with your recovery and should be chosen prior to surgery. This is usually a family member or close friend. Your joint coach is someone that needs to be available to help you at home, and they also need to be present on the day you are discharged from the hospital. Your joint coach will be educated regarding various aspects of your recovery, and you will likely need assistance from your coach with managing your shoulder dressing and pain catheter. Your coach will also assist with bathing and getting dressed, managing your ice therapy, supervising your exercises, and helping prepare food. All patients undergoing shoulder replacement need to be evaluated in the anesthesia workup clinic known as the Center for Pre-operative Assessment and Planning, or CPAP. This appointment is made for you within 30 days of the surgery by the nursing staff of your surgeon. The purpose of the anesthesia workup visit is to review your medical history, current health and current medicine list. During this workup, you will likely have routine blood work, possibly an electrocardiogram, or EKG, or chest x-ray. The providers at this clinic may reach out to your specialty doctors as needed. They will also educate you regarding which medicines to hold prior to surgery and which to take on the morning of surgery. Check in with your primary care doctors and any specialist, such as your heart or lung doctor. In some cases, your primary care or specialty care doctor may need to evaluate you before surgery. Schedule an appointment with your dentist before surgery to make sure your teeth and gums are in their best health. Healthy teeth will help lower the chances of infection after surgery. If you need to have any dental work done before surgery, you must notify your surgeon's office as soon as possible. After your surgery, you need to wait at least 3 months before having any routine or elective dental work, such as teeth cleaning. Preventative antibiotics are recommended for at least the first 2 years following your joint replacement before any dental appointments. Please notify your surgeon's office of any future dental visits so you can be provided with the appropriate antibiotic. We recommend that you stop using all nicotine products before surgery. This includes cigarettes, nicotine gum or patches, chewing tobacco, e-cigarettes, and vaping products. Your body will recover faster. You will have lower risk of infection by not smoking around the time of your surgery. Please contact your surgeon's office or refer to your journey guide for smoking cessation resources. In those with diabetes, blood glucose control is needed. A blood test called hemoglobin A1C will be performed prior to surgery. In order for you to be able to proceed safely with surgery, your hemoglobin A1C needs to be under 8. Uncontrolled diabetes can lead to delayed wound healing and an increased risk of infection. Maintaining a healthy diet and lifestyle is very important to your recovery. Eat well-balanced meals consisting of fresh fruits and vegetables as well as lean proteins. Examples of lean proteins are beans, lentils, and fish. Make sure you are staying well hydrated before and after surgery as well. Please do not consume any alcoholic beverages for 72 hours before your surgery. There are simple ways you can prepare your home before surgery to ensure you have a safe environment in which to recover. Move commonly used items in your bedroom, bathroom, and kitchen to within arm's reach or within waist level. Remove trip hazards such as throw rugs, extension cords, and toys. Tackle household chores before surgery such as cleaning your home and laundry, or enlist some help for afterwards for yard work, caring for your home, children, or pets. Make sure all stairs inside and outside of your home have a sturdy railing. Make sure all areas you walk in are well lit. Change burnt out light bulbs, and if needed, add extra light to see. Pre-make and freeze healthy meals for easy food preparation during the first days after surgery. You will shower the night before surgery and the morning of surgery. First, wash your hair using regular shampoo. Do not use conditioner in your hair. After you rinse your hair, shower with special surgical soap given to you by the nurses. Apply surgical scrub with a washcloth and keep the soap on your skin for 2 minutes before rinsing it off. Don't use the scrub on your face or genital area. Then use a clean towel to dry off. Do not put deodorants, lotion, or powders on your skin after showering. Make sure you sleep in clean pajamas and sheets the night before surgery and don't allow pets in your bed. Do not eat any food after midnight. In some cases, you can drink clear liquids on the morning of surgery. This will be explained to you by your surgeon's team or providers in the anesthesia workup area. For your stay in the hospital, remember to pack appropriately. You should bring a set of loose-fitting clothing for when you are discharged, such as a loose or oversized shirt with a wide neck, elastic band pants, and slip-on shoes. If you have dentures, glasses, and hearing aids, bring those as well. If you use a CPAP machine when you sleep, bring this device with you on the day of surgery. Do not bring valuables such as jewelry, watches, or money with you to the hospital. To learn more about what to expect during your surgery and hospital stay, please watch the next video of this education series.